Hey everybody, thank you to those of you who are on here just a little bit early, or actually right on time. We're going to give everybody just a minute or two to get into the webinar and get audio set up. So we will be starting in just about 1 minute. Thanks again to everybody who's jumped in, maybe like 30 more seconds just to make sure everybody has a chance to get logged on. All right, folks, thank you for joining us today. My name is Liam. I'm going to be the presenter. I'm one of our senior account executives here at Compliancy Group and been here for just about 6 years now. In general, the topic of today's webinar is going to be managing your overall compliance program across what might be multiple facilities, general principles and key takeaways for you to keep in mind as far as how you can simplify some of these things. We are going to take a little bit of a broader approach as far as how we speak about this for the purposes of today. So typically, we might focus on maybe one regulatory standard, something like HIPAA or OSHA compliance, but really the goal for today is that these are principles that you can use in how you manage the compliance across all of your facilities, regardless of the framework that you might have implemented right now. And that could be something like an accreditation, could be HIPAA, could be OSHA, could be SOC 2, could be fraud, waste, and abuse, STARK, anything else. These are going to be general compliance principles that we want you to be able to bring back and utilize internally. Okay, we're going to start by going over some general fundamentals, the 7 elements, the OIG requirements as far as compliance is concerned. We'll then continue to expand that out, talk about the general cycle of compliance that should exist within most organizations, and then get laser focused into some key areas here, especially for those of you that are on here in more like a mid-size organization. Great to hear from you. Thanks for coming on. All right. So quick, one or two quick polls. First question, and this is kind of an important one for those of you that are on here today, is are you responsible for compliance within your organization? So you can just take a second and fill that in for me. You can just say yes, no, or maybe you're only partially responsible. You're part of a team who is managing this. Or you can answer yes if you are the compliance officer and this is something that rolls up to you. Going to give everybody just a second to fill this in. Okay. If you are not responsible for the compliance program within your company at all, I will just say, looks like we have 54% yes, 38% partially, only 8% no. I will say, unfortunately, for those of you that answer that question no, there might not be a ton for you in the presentation today. This is really going to be more so designed for the people with a direct hand in the management of the compliance program. However, there probably will still be things that you can learn as you're listening today, or you can forward it on to the person that is. Maybe you were sent here just to do some information hunting, right? One more question, which is, what standards and regulations are you currently tracking? And this could be either what is most important to you. You can select all or more of the following, because oftentimes different roles and responsibilities apply to different people, and there might be different areas of focus for you specifically within your companies. And so certain things are universal, other things might be more isolated down to an individual role that you play within the organization. Looks like we've got a bunch of votes coming in. Give everybody just a second. All right, so as I guess anticipated, 100% of you selected HIPAA. if you're in healthcare, HIPAA is going to be a very well-known standard. I hope everybody picked that one. It's very unlikely that you are not covered under the HIPAA rules. 62% said OSHA. Maybe either you are in an environment or in a particular role where OSHA is not important to you, and that's okay. 31% said SOC 2, which is actually interesting to me, that if that's an important thing to your environments. We'll talk about some of that as well. 69% mentioned OIG 7 elements, 23% other. If you have any of those standards that you are most primarily interested in or that you're handling, for those of you that answered other, go ahead and send those into the chat box. We'd love to see what you're currently handling today. Okay. So with all that said, a couple of housekeeping items. Keep in mind that all of our webinars are recorded. I always get at least maybe 3 or 4 questions from people at the end of our webinars asking if these webinars are recorded. Yes, every webinar is recorded. You will receive an email with the recording and a PDF copy of the slides after the webinar today. Just give it a day or two, okay? Second thing is, please ask questions. We love getting questions. We love to engage with what is most important to you specifically. So if you're coming today, even with a very specific concern or an issue that you are trying to figure out how to navigate and address, go ahead and ask those questions in the Q&A box, okay? We would love to chat through it with you and hopefully keep this relevant to what you're hoping to get out of today, right? With all that said, I'll quickly introduce Compliancy Group. We'll get into some more of the nitty-gritty. So a little bit of background on our company. We have been around for about 18 years. We have built our business around the idea of being the affordable industry standard for simplified compliance. Our mission statement is that we simplify compliance so our clients can confidently grow their business. Our goal is simplicity as far as how you are able to manage these requirements. We have been doing this for a long time, roughly 18 years. We have about 6,500 organizations that are currently using our program. And in the history of our company, most important thing I can tell you is we've never had a client that has ever failed a HIPAA or OCR audit or been fined, okay? We do a pretty good job as far as that's concerned. Originally, we started out as a HIPAA company. Over time, have evolved to handle multiple different frameworks, OSHA, SOC 2, along with the ability to track custom frameworks utilizing our software platform, which is called the Guard, okay? And I don't say all of that to give ourselves a pat in the back here. I say it primarily just to give you some insight as far as who you're talking to. We have been doing this for a long time. The principles that we have implemented with our clients and over the last 18 years have been proven to work. And our goal for today is just that we are able to share some of that wisdom with you as we go through, okay? Now, and you can see some of our awards and endorsements here. Again, we're pretty well-recognized name within the space. So, compliance fundamentals. For those of you that are experienced compliance people, this is going to be super familiar to you as the 7 fundamental elements of an effective compliance program, okay? For those of you that are not familiar with this is really the bread and butter of compliance, okay? This is the most basic, fundamental, boilerplate expectation of any compliance program. Any framework that you are managing relevant to compliance rolls right back up into here. And one of the things that we wanted to talk about to begin with, before we even start going through some of the individual components here and how this is kind of layered out across multiple locations and key principles for how to manage this, really, one of the more important things to talk about is this word effective, okay? You have many, many different types of regulatory standards. You have really a very broad industry that those standards apply to. You could have a small single doctor practice that the HIPAA rules are regulating, let's say specifically. You could have a large regional hospital system and many, or a health plan, an insurance company. The law does not change, right? So the regulatory standards themselves typically are going to apply the same across the board, regardless of the size or the scope or the nature of your business. One of the general expectations for compliance is not just that you are checking requirements off of a box for the sake of saying that you're doing it, but rather that you are understanding what might be sometimes broad guidelines and implementing them into your organization in a way that is very specifically effective for you. And so what does that really even mean? Well, in a lot of ways, this could be the practical application of these 7 elements might vary depending on the specialty that you are operating in. Are you a multi-specialty clinic, or are you a dental practice? Or are you a specialist or a surgical group? Could be the size of your organization, right? Could be the uniqueness of your operations and the specific roles and responsibilities that you have internally, okay? What effective compliance means is essentially that relevant to your environment, you are not just having canned policies, right? But rather that you are taking your policies and building them in a way that is going to uniquely apply to your organization and be an accurate reflection of your business, right? Effective compliance, as you can see what it says here, is applying the standard to your organization in a way that's effective for you. Where a lot of people go sideways with this is they will implement tons of policies and a lot of documentation, but their operations in practice look completely different, okay? A compliance program is not effective, and that first element of the 7 elements is internal policies, procedures, right? That is what compliance is. What are you complying with? Well, you're complying with your internal policies and procedures, okay? Having policies and procedures, though, does not make you compliant. It's everything else. It's making sure that your employees are reviewing those policies, that they're receiving training. That comes back to effective lines of communication, okay? Making sure that it is being monitored and audited on an ongoing basis so that you are ensuring that these are actually being followed. Identifying potential compliance-related issues and handling them properly when incidents occur. Okay, if that's not what's happening, if you can honestly look at your organization right now and say that your operations in practice are not reflecting what your policies show on paper, that either means that you have significant compliance issues, or it means genuinely that you might want to make changes to your policies so that it is a more accurate reflection of your company, okay? And in general, policy decisions that are decided at the top, okay, might not always be the most accurate reflection of what the day-to-day looks like for the people within your company, okay? And so part of that is taking kind of a holistic approach to this. And the funny thing, and it's an example that we talk about all the time, is that in general, these types of frameworks, okay, is exactly what many of the biggest corporate brands in the United States use to ensure that they are maintaining consistency and quality of service for their clientele and their customers as well. So even you see companies like Starbucks, okay? Do you want to know why Starbucks has become such a massive national brand in spite of the fact that they have thousands of locations across all 50 states? Well, it's because I can go to my local Starbucks here in New York and order my favorite cup of coffee, and then I can fly across the country to California, go to a completely different Starbucks in a completely different state, thousands of miles away, but not only will my cup of coffee taste exactly the same as the cup of coffee that I ordered in New York, I am going to receive a remarkably similar level of customer service across all of those facilities because they have implemented what is the equivalent of a compliance program, the 7 elements. They have clearly documented policies, a robust training program. They have delegated people at each of those facilities to make sure that these things are being followed in the form of site managers. They have clearly established disciplinary guidelines. They monitor their facilities and their locations to ensure that these things are being abided by, okay? And in general, you want to get your organization into what I would call is a life cycle of compliance, right? Where you're doing assessment, right? And particularly under HIPAA, HIPAA uses the term ongoing risk analysis, but the 7 elements might say ongoing monitoring and auditing, okay? You should be assessing yourself, identifying where your gaps are, but then implementing corrective action plans or remediation plans to address those gaps. Oftentimes, the issues or the gaps that you might find that could be things that are technical and you delegate those to your IT department, but most of the time, those are operational issues that are addressed or remediated through proper policy, procedure, and documentation, okay? Those policies and procedures don't mean much though unless your employees are actually being trained, if they were testing to those policies, if it's making an impact in your operations. You have third-party vendor requirements, then actually handling incidents that occur relevant to your policy and procedure requirements, disciplinary guidelines, the breach notification rule, all of these different things. And then guess what? You do it again, right? You are assessing, monitoring, identifying gaps, updating policies as needed, ensuring employee training. That life cycle applies regardless of the compliance framework that you are currently worried about within your organization. And it's something that needs to be done across all of your facilities. And that's what we're going to start to get into next. So there are, of course, some unique challenges of managing this across multiple locations. Now, some of that complexity could be that you have diverse workflows, right? Each location has some uniqueness to them, making it challenging to maintain this. There could be multiple states involved with varying laws based on a state-by-state regulation, and it could be cross-communication of all of this data. Right? In general, as far as the more locations that you have, the more complicated it's going to get. It's a lot more that you need to be tracking. It's a lot more that you need to be documenting. There's a lot more complexity that gets layered in. And that could be because of growth, right? It could be, right, so as you acquire practices, if that's what's happening, or as you are building new practices, you need to make sure that these things are being rolled out in a way that makes sense. The ability to integrate your policies and procedures in a consistent manner across all locations is tough, right? And if you're not centralizing all of that back into one place, it becomes super messy really quickly. Being able to report on this centrally back to your main facility, right? So if you can't right now open something up and see specifically what you are doing across all of your facilities back up to the corporate level, that's a problem, because if you were ever audited for something that happened at a facility, you're going to need documentation of it, right? And then, of course, monitoring all of this is monitoring, maintaining, tracking. It's a huge challenge. So let's talk about some practical ways that you can make this a little bit easier, some key things that you might want to keep in mind as you're doing this within your organizations. So policies and procedures is, of course, the first place that you always think of. It's the first component of the 7 elements. Again, it could be fraud, waste, and abuse, the OIG requirements, Stark, HIPAA, OSHA, whatever it is. Especially in practice environments where you have multiple locations because you are acquiring practices that already existed. That is going to be where you want to have standardization and consistency through a unified set of policies and procedures that apply org-wide, regardless of the practice, okay? That's one of the first things that you want to think about is what of our policies apply across the board, regardless of the practice or the location that they're being distributed to. That, number one, will help you start to create some of those standardizations that need to be created, along with consistency, not only for compliance practices, but in just even quality improvement, right? Part of how you build a brand is by making sure that your patients are being treated in a very consistent, equitable way, right? And that really comes back to your policies and making sure that these are being implemented. You're going to want to start by figuring out what applies across all of our facilities, regardless of the practice. Number two, once you have done that and you have that unified set of policies that apply to everybody, that is when you could begin to customize either based on local requirements or individualized specialties. You can either layer in some of those differences with clarifications for your facilities, or you can make separate sets of policies that apply to those individual locations themselves for the requirements that apply to them, okay? This is more than just about risk mitigation, it's also about quality of care, right? Making sure that those policies, again, in practice, reflect what's on paper. Okay, so those two things, figure out what needs to be standardized, and then figure out what needs to be different, and either layer those into your standardized policies or track them separately entirely. Another big piece of this, and so two whole components of the 7 elements come down to what employee communication, basically, right? Making sure that there are clearly defined lines of communication so that what is decided upon at the top, at the corporate level, is being very clearly disseminated down to all of your facilities and the individual employees themselves. And this is a very similar thing. In addition to your policies, and this is a very common issue, you should have some sort of a mechanism in place for making sure that your employees are actually attesting to your policies. Having training modules is what we're going to talk about in just a second. But if you have no way of proving that your staff is actually reading and agreeing to your policies across all of your facilities, it's kind of a problem, okay? Because again, you have no way of proving then that these are actually being made actionable or that they're being implemented. Now, training is a little bit of a different thing because training really deals, it could be super broad, but right, training tends to be a little bit more practical, less of a, hey, read this policy and let us know that you read and understood it. That's great for limiting your risk. But in terms of actually practically making sure that your employees are doing what they're supposed to be doing, effective training is super essential. And so part of this, you might have like an e-learning system or an LMS that you're utilizing that might come preloaded with pre-existing trainings that you want your employees going through. One thing that can never hurt is making your own training modules or presentations that you record and distribute to your employees or test them on that apply to all of your facilities. And then at each facility, if there are different requirements for training that apply at the individual level, distribute those separately, track them separately. Okay, but as far as org level trainings, you want these to be consistent in the content and how you are delivering them. An e-learning platform like an LMS tends to be the easiest way to do that when you're scaling across multiple locations. But then once you have that kind of standardized set, this will need to be localized as well. Okay, not all locations are going to come across the same issues. You need to make sure that, again, you are now layering in, figuring out what is standard, and then layer in what is unique at the level of the states or the individual practices, developing some of that tailored content, and then tracking all of this to make sure that all employees have been trained effectively. When you have multiple locations, one of the really important things is you might not be able to be at every single one of those facilities to be conducting consistent auditing, but there should be somebody at those facilities that is responsible for this, that communicates with you directly about compliance related issues at that location, okay? So think about who your site managers are, think about how you communicate with them. Part of that ongoing monitoring process, you may want to create some sort of a recurring touch base or meetings you have with those site managers to talk about things that they should be training their people on, things that they should be thinking about, and having that consistency in communication, really great way to make sure that this is staying standard across all facilities. Other things might have to do with, and this is particularly a challenge for practices if you are multiple sites and you're acquiring practices that have their own vendors. Tracking of things like business associate agreements, vendor assessment, and data privacy requirements for things like the omnibus rule. It's really challenging. Usually our recommendation is anytime that you are adding a new practice, you either want to create a process within which you are offloading and then reintroducing and standardizing the vendors that that practice utilizes, or you want to have an established process for collecting the data that you need on those vendors. And that could be in the form of a business associate agreement or a vendor assessment you are distributing to those companies, okay? So make that a part of your checklist. You know, if you're opening new practices or potentially acquiring ones that already existed, those acquisitions tend to be where the biggest compliance issues can take place. So just making clearly defined processes and a checklist of things you do whenever that happens, it's going to be really important. Okay. And again, there are numerous standards and regulations that you could comply with. We asked some of these questions at the beginning. You might be going, it could be federal requirements, HIPAA, OSHA, Fraud, Waste, and Abuse, False Claims Act, STARK, or it could be elective ones, things like accreditations, if you are CARF accredited, HCCA, could be SOC 2 if you're implementing a more advanced security framework. And in general, we speak with some practices that because they're not billing Medicare, think that things like the HIPAA requirements that might not apply to them. But really, if you're billing any state health insurance, you have to abide by the same state rules as the CMS. And federal HIPAA requirements apply if you bill any health plan, period. You're a covered entity, okay? So we've come across practices that try to think that they're getting away with not having to comply. But in general, it's nothing to be scared of. A compliance program just in general is going to improve your service that you're giving to your patients and help you build a better organization overall. That's what the goal is, right? And in general, again, the 7 elements is what this all rolls back up to. Implementing written policies, procedures, and standards of conduct. Designating a person to ensure that they are followed. You might be the compliance officer, but you should have site managers that are responsible for your individual facilities. Effective training and education, as well as lines of communication, which we spoke about. Some sort of internal auditing and monitoring process. That could be annual assessment, that could be ongoing risk assessment, is at least what HIPAA requires in the terminology from HHS. Then enforcing those standards through well-publicized disciplinary guidelines and responding promptly, right? That's the incident management piece, okay? You see a lot of real-world issues, and nowadays you see a lot of the owners and the board members of practices that are the ones having these fines levied against them. We're gonna talk about just quickly a couple of cases in which this tends to go wrong. And what happens is as practices grow, especially rapidly growing practices, if that's you wind up having compliance issues just by nature of the game. And so maintaining that standardization and that investigation process of anything that could be happening. This particular Spine and Sports Care Medical Center, from 2016 to 21, LAGS performed medically unnecessary procedures such as skin biopsies to test for fibroneuropathy, surgeries to implant spinal cord stimulators, and invasive surgeries, last resort chronic pain, and testing, medications, substances, is classic fraud, waste, and abuse investigation here. The DOJ investigated them. LAGS Medical agreed to pay a little bit over $11 million to resolve allegations that they violated the False Claims Act, Medicare, Medi-Cal, and Orkin Medicaid program, okay? Big issue here, again, if this was being continuously monitored, if they had processes in place for handling situations when these arose, maybe anonymous reporting mechanisms in place, could have been avoided. New England Dermatology, this was actually not only a breach that took place due to them disposing of paper records improperly. This particular practice was fined a lot of money, $300,000, because they couldn't prove that they had completed any type of a risk analysis. Specifically for HIPAA, this was an OCR investigation, found that they had never done a risk analysis. They did not implement the right policies concerning secure disposal of PHI, resulting in a $300,000 fine. If you are looking for a way to centralize some of these things, that's going to conclude the majority of the content for our webinar today, folks. We're right at the 30-minute mark. If you have any questions, feel free to submit them now. What I would say is that if you're looking for an easier way to manage this, our compliance management platform is designed to allow you to simplify these processes across all of your locations, automate the way that you maintain ongoing assessment and auditing and monitoring documentation. We also utilize something that we call a freshness score. So we have pre-built frameworks for HIPAA, OSHA, SOC 2, but you can build in your own control sets and protocols inside of our platform so that everything is being tracked in one place and replicated across your facilities however you want them to be, okay? So again, that's the content for our webinar today. If you have any questions, happy to answer them now. If it's something of a more sensitive nature, you can also send me an email or you can give me a call. This is my phone number here. And I'm gonna take a peek at some of the questions we got. Okay, so yeah, somebody mentioned OIG, OCR, DOJ, FDA, EPA. Lots of 3-letter acronyms of things you might be potentially complying with. CDC, yeah, that's another one. I'm not seeing any other questions. Folks, if there's anything else that you would want to call out here, I'll give you another second. But if not, when you close out the webinar today, there will be a quick survey. If you could fill that out, that's really helpful for us just to keep our finger on the pulse. If you have feedback for me, please, and that could be good or bad. If you want to say, hey, Liam did a great job, we of course always appreciate that. That goes to my bosses. But if you have some honest feedback for ways that we can make these webinars better or more applicable to your environments, please give us that as well. We want to make these better if we can. And there'll also be a question asking you if you'd like to learn a little bit more about our program or have somebody reach out to you to give you a quote. Let us know. We would love to chat with you and get you some more information. So Clint, CEU credit is not automatically available for our webinars. We can send you the PowerPoint deck presentation along with a certificate of completion. You can, depending on who you get your CEUs through, you can always follow up with them and request it. We have a lot of companies that do that. Folks, thank you so much for attending today. I'm going to close this out. Again, reach out to us if you would like more information, and please give us some good feedback if you could. Thanks.